Welcome back to Face the Nation. We turn now to the mayor of New York City, Eric Adams. Good morning to you, Mr. Mayor.
Good morning. Good to be on with you.
Thank you. You have said that somewhere around 70% of hospital beds in your city are currently occupied. Are the hospitals close to being overwhelmed?
No, not at all. My daily briefings with my healthcare professionals, had one earlier today. They stated that we are stable and they're doing an amazing job. And those heroes and sheroes who are the nurses and doctors and hospital employees, we just need to really commend them for the job. And we're watching this closely, and we're going to make sure we respond and pivot as COVID continues to do so.
Well, we wish you luck with that. You have the largest school district in the country in your city, of course, and you have been very clear you are keeping schools open. To do that, you've given out N95 masks, required staff be vaccinated. Everyone's got to be masked. You've got air purifiers, you've routine screening, but you're not requiring a negative test before students return to the classroom. That's something they're doing here in the District of Columbia. Are you confident you can keep the level of transmission low?
You know, and it's so important that you laid out the things that we put in place, because COVID is a formidable and moving target. And we have to pivot and shift based on that. And our policies have been rooted in, I need my children in school. And if my medical professionals tell me, Eric, we have to do a mandated vaccine, we're going to do that. But right now, we have brought over 1.5 million tests in our schools, as you indicated, N95 masks, as well as other resources and tools. And we have been doing an amazing job because of one thing, coordination and communication with our UFT and other agencies involved. And I believe we're doing the right thing for our children, having them in the safest place, and that is in the school building.
That UFT, you're talking about the union there, but you've kept schools open, but the plain fact of the matter is people are still going to get sick. And I know you have had some staff shortages as a result of that. Attendance in school this past week was about 70%, so about 300,000 out of 1 million students missed class. Are you going to have to elongate the school year to make up for all this?
You know, I'm so glad you said that, because I think many people are missing. There was an amazing article in the New York Times that stated this is the first time we spent more time and energy around protecting adults than the future of our children. I'm troubled that we almost had a 2-year loss for our children. They're behind in math, behind in English. We're going to sit down with my new chancellor and stated, how do we start doing the catch up? Because remote options are not really being used and can't be used correctly for those children who don't have access to high-speed broadband, need the meals that they need. I know we have to look at a different way of living with COVID each time a new variant comes out, and one area is education.
But you do have these staffing shortages, as many schools are seeing around the country. The federal government says they're giving out plenty of money for you to hire people to come in. But how do you get someone to take a job as a teacher right now in the middle of a pandemic at a low wage?
Well, we need them in, and our teachers are paid accordingly to a great union contract, and they get the support that they deserve. And we need to attract people to do what I like to say, teaching is a calling. We're not just trying to make sure we fill a job applicant. No, we want the best in front of our children.
Right.
And what we have done successfully here in this city is pivot and shift based on the needs and how COVID is changing. We must learn to live with COVID, and we have to do it in a safe way.
Well, we may have to live with it, but for the infection rate, when I look at the New York State Department of Health report, which I just did, it said potential increased severity of the Omicron variant may also play a role in increased rate of hospitalizations for children under age 11. What makes you confident that Omicron isn't causing bad outcomes in kids when the state makes this point?
Well, let's look at something else the state and city is stating. A child is 4 times more likely to be hospitalized if they're not vaccinated. So I am saying to my parents and the people of New York, get vaccinated and get booster shots. we don't have to feel helpless like the beginning of this virus in 2020. Science and global communities came together. We now have the tools that we need. So let's empower ourselves with the vaccination and booster shots.
Right.
If we do that, we will bring down those hospital rates, and that is what I'm encouraging parents to do.
But some parents are just not vaccinating their 5 to 11-year-olds, that younger demographic. But what about kids who are 4 and under? They don't have an option to take a vaccine, and that is where you're seeing the fastest growing infection rate, according to the New York State Department of Health. Are you going to keep daycare facilities open? Or are you going to keep preschools open when those kids can't be vaccinated?
Yes, we are. We're going to continue to do what we're doing, coordinating with our healthcare professionals. When you start to disrupt the stability of childcare, of daycare, and education, it has a rippling impact throughout our entire city. Parents can't keep their children home. They have to work. The economy is also part of this crisis that we're facing. And with the proper balance of creating a safe environment inside our daycares, our schools, and other locations, our parents can go and do the jobs they need to do. And that is what I must face in the city. We have to ensure the financial ecosystem is healthy, as well as our children and our families are healthy at the same time.
Mr. Mayor, we'll be watching. Thank you for your time this morning.